So is President Obama just using the government option as a chip to negotiate? Let's ask Maine Democrat and member of the Progressive Caucus, Congresswoman Chellie Pingree. Congresswoman, it's good to see you. Nice to see you. Thank you for coming on the show. So is this just a bargaining chip? What is going on here?
I think it's an essential part of a health care plan. I see this a little differently than the former speaker. You know, most of my constituents, small business owners and others, when they come to me with complaints, it's the bureaucracy of the insurance companies. They pay for insurance, it's denied when they need it, they think the costs are going up at way faster than inflation. It's the biggest concern of small businesses in my district and of the economy of the state of Maine and so many other states across the nation. I think a public option introduces competition. It allows us to bring down costs in a variety of ways. I think it's essential to really reforming the system, and that's why it's an important point for the president, an important point for so many members of the Congress.
You know, Congressman, do you see the message from the town halls, though, the meetings there, that the American people don't get it? You're saying you want to expand coverage to cover the uninsured to save money. We get it that the uninsured need coverage, but the CBO is saying it's going to cost a lot of money.
Well, the CBO says if you have a public option, you actually bring down the costs. And I've been at those town halls. I've met with my constituents ever since I got elected and during this summer as well. And again, I have to say the number one concern I hear from people is it's awful dealing with the insurance company, or I'm a small business and I can't afford the rising cost of insurance today. In my state, 78% of the insurance comes from one insurance company. I mean, where's the competition out there? I'm from a state that's tried a lot of insurance reform and it hasn't worked. We're saying to the federal government in my state, hey, you got to do something to help us here. You got to help bring down costs, or we're never going to get this economy growing again. People aren't able to start new businesses. They're not able to leave their job because they're afraid to leave the existing coverage, but they often find when they need it, it's not there for them.
I think, though, that the CBO analysis did say that the public option it would blow out the deficit, because what would happen is people on regular insurance plans would run to the government if they didn't like their own insurers. As you note, you only have one insurer in your district. Don't you think that would increase taxpayer costs if a public option was out there?
Hey, look, part of the idea is to have an option out there. It's like saying to people, hey, if Medicare was available to you, and my seniors are very happy with Medicare, if we were to say to people, you know, if Medicare were available to you at a reduced cost, would you go for it? I mean, the fact is, it's not my job to worry about insurance company profits and high CEO salaries. It's my job to make sure that people have adequate coverage and it's at an affordable cost. That's what we're trying to do here.
I hear what you're saying, but, you know, Medicare is $44 trillion in unfunded liabilities. The boomers may retire without Medicare, and if you have Medicare for the middle class that's government paid for, it will blow out the deficit. No?
Right now, if you have insurance, you're paying about $1,200 extra to cover the uninsured. My hospitals are drowning in charity care and uncompensated care. I mean, we already have such a huge health care cost out there that we're not dealing with. As the president says, the big issue for us is doing nothing and not facing this huge challenge to our economy. I mean, small business owners right now are saying to me, what am I going to do about these escalating costs? I can't continue to cover my employees.
All right, Congresswoman, it's good to see you. Thank you for your time. Really appreciate it.